As the controversy builds over the Supreme Court order asking that even the private testing laboratories that are testing for the coronavirus should test for free. I'm joined by someone who's come out as a very strong critic of that. Kiran Mazumdar-Shaw, Chairperson and MD of Biocon Industries, joining me from Bangalore. Thank you, ma'am, so much for joining me. Now, you have, of course, been very critical of this order, though some would say that the whole idea behind it is to make it more affordable and to be able to actually increase testing. You're saying this could have the counter effect. Why is that?
So, I just want to start by saying that nobody argues about the fact that the test should be free. But the big question is, who should bear that cost? Should it be the diagnostic companies? I don't think that's correct. I think this cost should be borne by the government and the insurance companies. I think 55% of people are not insured, and that's what the government should underwrite. And those who are insured, I think the insurance companies should pay for it. I don't think the onus should be on the diagnostic companies because these are small organizations.
Okay.
They are labor-intensive organizations. They have running costs. They don't have cash. These are stressed businesses because right now their businesses are absolutely down because of the lockdown. And I think they're willing to do these tests and they're doing it at cost. So I really don't think it's fair to tell them to do it free of cost.
So you're saying
and if you insist that they do it free of cost,
right,
they will have to significantly downscale. And then you're not going to have the ability to scale up testing, which is so badly required today.
Right. You're saying that if the order is very clear, if there's going to be no change in that, if the government is not going to underwrite it, if the insurance companies are not going to underwrite it, then these companies will simply have to scale down testing.
That's right. Because they can't sustain. I mean, these people need cash to buy the kits, to do the collections, to basically operate their businesses. And if they can't do that, it's actually going to have a huge economic impact for this sector because they'll have to lay off people.
Right.
These are people, who are from the low and middle income sectors. And it's at this point in time, you don't want any layoffs. You don't want to deprive people of their livelihoods. These are important, essential services.
To the point about the price of the private testing, though, which is, I think, has become the main issue, that it's, the fixed price is 4,500 rupees, which many say is unaffordable to a lot of people. Could one argument be to try to perhaps make that a little more realistic in terms of at least being for people to be able to afford it, of reducing that price? Would that help in any way?
This price has been arrived at by the ICMR. Please understand that this is a at-cost price because this is what it costs the government. The government has clearly told us this is what it costs us and this is what we are willing to pay. And I think the diagnostic companies did not even argue. They said, fine, as a humanitarian service, we will do it at cost.
Right. So this is, you can't really reduce this any further. You're saying this is
unless you have
cost price.
That are cheaper. Unless people come up with much cheaper kits, which I'm sure hopefully will happen over the next few weeks or months, then only those costs can be reduced. But at this point in time, the kits that are approved by the ICMR have a certain cost, have a certain built-in cost. And these rates are actually based on those kits.
Right. So effectively what you're saying, because I think the court in its order said that this is a time for everyone to be philanthropic, even these private testing labs should consider doing some philanthropy or public service. You're saying that these companies and lab companies are anyway fairly small businesses. These are falling in the medium and small scale industry category, and they don't have the kind of bandwidth to be able to do that, essentially.
Yeah, and Vasu, let's face it. I mean, if you want philanthropy, let it come from the big guys. Let big companies come and provide CSR funding for free testing. But don't ask small people, because as it is, they are philanthropic. They are doing it at cost. I think how much more philanthropic can they be?
Okay. Let me ask you this, though. I mean, just pulling back a little bit from this whole question of testing, that if you look at now the numbers, we are registering increasingly higher and higher numbers of those infected. Also, worryingly, the number of deaths are rising. But that's also because we are testing more. We are testing much more than we were earlier. We're testing 11, 12, 13,000 a day. So would you still say that there is cause for concern in the manner in which the disease, the arc of the disease in India? How do you read it at this point?
So the way I look at it is, look, we need to test more. In fact, today we are at a 14,000 tests per day kind of level, which itself is not bad, because many countries are hardly able to test 10,000. So actually this is commendable. But for a country of our size, we need to at least have 100,000 tests a day. That's the kind of minimum level we need to really get. Yes, so to really get some kind of extrapolation of data, we need those kind of tests per day. Now, if you actually, with that data, one of the data points that you should look at, Vasu, is that, look, if you look at the number of tests and the number that translate into positive numbers, that's quite small even now.
Right.
So I expect the number of tests to go up and the number of positives also to go up. In fact, we want more positives to go up, in the sense that we know many people are quarantined. We know many people would be positive.
Right.
And I think we need to get those numbers out. Now, for instance, if you get the denominator, which is the number of positive cases, to keep increasing,
right,
then relatively speaking, if the number of deaths are small, then you are in a safer position to take a call.
Yeah.
But today, you keep focusing on the number of deaths that are increasing per day and the number of positive cases that are increasing per day. Even that proportion, if you look at it, you had something like, today I think there was something like almost 860 cases that were reported as positive.
Yes.
And you had 24 deaths.
Right.
But supposing you had 1,000 or 2,000 cases testing positive and you had 24 deaths,
sure,
that would have looked a lot better.
The mortality rate or the fatality rate comes down.
So you need to focus on that kind of data point.
Okay.
And that's why you need to test much more.
Okay,
and then I also think we need to do rapid serological tests in certain clusters and communities which are at high risk.
Yes, I think now finally the ICMR has given the green light to those rapid tests, what are called the antibody tests, and I think that's also going to start fairly soon. I don't even know, I think in certain states it's already started. Let me ask you where we are in terms of a vaccine, working on a vaccine here in India. Are you at Biocon working on anything close to that at all?
So we are working with a few companies on developing vaccines.
Okay.
And there are a number of vaccine initiatives around the world. Let's hope that the vaccine is developed sooner than later, but that the soonest it can happen is really a year down the line. So I think until the vaccine actually comes into the world and is able to immunize people, I don't think anyone is going to feel safe. So I think that's why we need to actually come up with a number of therapies that can actually cure this disease and not have so many fatalities. And if that can happen, and then we get into a much more confident and safer zone of comfort, then only will we feel a little more reassured that, okay, things can resume to normalcy.
A year is a realistic time frame, you're saying, for a vaccine? As long as that?
Yes, unfortunately.
Okay. All right. Kiran Shaw, always a pleasure. Thanks so much for speaking to us.